every year. The federal government, for instance, spends just 82.8 billion on feeding children, just matching what the states may choose to do. It could actually feed more than 9 million school children every year. So you can see for yourself why you cannot simply spend 150 billion on some politicians. Now let's take another example of direct intervention which is possible. This is health intervention. The National Health Insurance Scheme, NHIS, already provides for a reduced premium payment of 12,000 naira per annum for coverage. Now, that scheme at the moment accounts for 1.5% of Nigerians. Imagine a situation where the federal government intervened and funded the health insurance of the most vulnerable Nigerians. For example, pregnant women and children between the ages of 0 and 5 years. There's a multiplier effect. As the healthcare system expands, it means more doctors, pharmacists, nurses, and other healthcare providers will be employed. It means a boost for our local pharmaceutical industry. Indeed, local governments may even benefit because they may also expand their primary healthcare facilities to make room for the expanding number of persons who have access to the medical care system of the nation. In most emerging countries, the percentage of people with healthcare insurance coverage may be quite low, with the exception of China. In 2010, China successfully brought close to 90% of its population from less than 25% in 2004 under the purview of 3 state-run health insurance schemes. This has helped China's rural population have better access to healthcare. Brazil also has 25% of its population covered by private insurance. Public and private health insurance covers about 25% of the population in India as well. I think it's entirely possible for us to run a creative healthcare insurance system. Today, several innovative strategies, especially the use of microfinance institutions. Again, direct intervention is possible. Osun State, for example, about 2 years ago, employed at one go 20,000 graduates. Now, this was an emergency intervention that the state government decided to undertake. While in the employment of the state, these 20,000 graduates were also being trained. Aside from being occupied in services to the state, some were trained in entrepreneurial skills, some were trained in IT. In fact, a large number of them were given different forms of IT training. Some were even trained as farmers. While all of this was going, of course, they were being paid a stipend. Now, take the situation of 300,000 tertiary graduates who are currently unemployed. It's entirely possible for the federal government, as a palliative measure, to decide to engage these graduates and pay them anywhere between 20 and 25,000 naira as a stipend per month while training them in the various skills that I mentioned earlier, trying to prepare them for a more useful life. And of course, in that period, taking them out of poverty. The cost of that Assuming, for instance, that they were paid a monthly stipend of 20,000 naira, just a stipend, not a salary. The cost would probably be about 6 billion monthly, something like 72 billion annually. Of course, if they're paid more, you can simply do the math. Now, it's important to understand that this is a palliative. It's just a short-term intervention, but it assures these young men and women of some living expenses and the road to learning the vital skills that will sustain them in the future. And of course, in that period, taking them out of poverty. The cost of that, assuming, for instance, that they were paid a monthly stipend of 20,000 naira, just a stipend, not a salary. The cost would probably be about 6 billion less, something like 72 billion. Of course, if they are paid more, you can simply do the math. Now, it's important to understand that this is a palliative. It's just a short-term intervention.
Thank you very much for your patience. And I'm so sorry that the last bit there got stuck. But I think the point to be made is really that poverty is a human condition and it can be solved by human beings like ourselves. And we're going to talk just a little more about some of the other initiatives. Of course, there's the long-running argument about whether or not you can actually sustain economic growth and social expenditure at the same time. There are those who say that you can't throw money at poverty and expect it to be solved. Yes, that's true on the long run. But when you have an emergency such as we have, where 70% of the population are desperately poor, then you really must do something on an emergency basis. And some of the schemes that we've seen and some of the models that we've looked at are that kind of intervention. And those kinds of interventions are extremely necessary if we are to ensure that while we are waiting for the long-term plans, the poor and the deprived don't die out completely. Now let's talk a bit more about some of the solutions to the poverty trap. Look at social security, for example, especially for the elderly and the vulnerable. Now, some states have already started doing some of that. There are people who are over the age of 65 who have no pensions because they've never worked with any kind of organized way. They were probably in some informal trade before they retired. So at the age of 65 and all of that, they're living in their villages completely powerless and have no money whatsoever. Then there are the vulnerable as well. There must be social security provision for them, one way or the other, because these are people who cannot work. And the only way to do it is to provide. Fortunately, some states have already started to do that. And two states, Ekiti State again, Osun State. By the way, I'm not from Osun State, but they have some really interesting programs, and I think that some of them are really worth talking about. Now, these two states have some kind of social security for the elderly and the vulnerable. In Ekiti State, they provide some money for those who are too old to work. And I think it's important for us to understand that poverty, especially for the very elderly and very vulnerable, is a particularly terrible thing. And suffering in old age is worse than suffering in any other type of condition. And it's so important the government must make those provisions. But let's just look quickly at education. Education as a way of